Hello and welcome to episode 2 of the Massage Matters podcast, part of the Physio Matters network. I'm Anna Maria Mazzieri, a soft tissue therapist, and together with fellow passionate soft tissue therapists Matt Scarsbrook and Becky DeMont-Horton, we created the Massage Collective to provide the link between traditional massage therapies and modern evidence-based practice in healthcare. The Massage Collective provides resources to massage therapists and indeed all MSK therapists who want to level up their understanding of what's going on under their hands and how massage fits within a contemporary biopsychosocial approach. The Massage Matters podcast is an opportunity to join us as we dive into all facets of massage and manual therapy, from exploring modern concepts to delivering best practice advice that you can apply immediately in the clinic. We'll be releasing new episodes fortnightly across all the usual platforms, so make sure you subscribe to stay up to date with all the latest content. Before we get started on today's topic, we got some really exciting news. After the success of the Therapy Live conference in June, the Physio Matters team are breaking new ground again, this time with Therapy Live Sport and a specific focus on the triad of swim, bike, run. The Massage Collective will be hosting a live Massage Matters podcast exploring massage as a tool for recovery post-training and post-event, which we are incredibly excited about and maybe just a little bit nervous. So get the 7th of November in your diaries now. There are only 5,000 spaces for the whole event, so click the link on our Facebook page to go and sign up. Right, it's probably time we go stuck into today's episode, mental massage. Are we alluding to a florage of our grey matter or something a little bit more cerebral? So Becky, what are we talking about today?
So it's tempting to view massage as a purely physical intervention, but have we in fact overlooked its overlap into the psychosocial realm? As more and more evidence is supporting the biopsychosocial model with regard to the treatment of pain and injury, we know that, depending on the client and the nature of their pain, there will be varying degrees of involvement from biological, psychological, and social factors. So do we need to start considering how massage can play a part in all of these factors, not just the biological? So know that this is something that Matt has researched extensively. So Matt, would you like to give us a bit of a rundown of some of the research looking at massage in the psychosocial field?
Absolutely. So I should probably start by saying my current biases do lean more into the psychology around pain and performance. Specifically anxiety and depression. That's largely because as you dig into the research regarding massage, this is where time and again we see the most consistent clinically significant impacts. So anyone who saw my presentation at Therapy Live in June will have heard how I suggested that perhaps within our BPS model, massage should be considered more influential in the psycho bubble than the bio bubble. Really, I just wanted to give a very quick overview of the most significant papers really that explore the efficacy of massage from a psychological perspective. So Tiffany Field, who's a researcher in the US from Miami, she's one of the first, if not the first, researchers to lead sort of university-based studies into the effects of massage. And wrote probably the most influential paper of the 90s in 1998, in which, in very much a review type form, she covered the existing research into many of the claimed effects of massage at the time and touched briefly on some of the possible mechanisms. It was really kind of the first paper that tried to draw together all of the research that had been done to date and explore both what it told us and perhaps what it meant. Now, from that paper, several ideas and studies haven't aged particularly well. For example, linking tight hamstrings to lower back pain and suggestions that massage lowers cortisol levels. However, it was the first time really that the effects of anxiety, the effects of massage and on anxiety and depression featured regularly, both as outcome measures, but also consistently demonstrating promising results. However, from a slightly objective perspective, a significant issue with this paper as a whole is that 1/3 of the referenced papers for this review were actually written by Tiffany Field herself as part of her research. Now, unfortunately, many of those studies didn't have control groups, and so the effects of the outcome measures measured could be questionable. But it's still a super important paper, because part of the reason that 1/3 of the papers referenced were by Tiffany herself was because no one else was doing the research to any kind of significant level. So it's a bit of a catch-22, I think, for Tiffany Field. But either way, it really did sort of start the ball rolling a little bit on, hey, let's look into massage a little bit.
I think we need to appreciate those researchers that they're asking the questions. That somebody has to start asking the questions. So although there are, important limitations to those papers, there are also, we need to appreciate that at least she started.
Absolutely.
And it's a quest for knowledge.
Yeah. Well, so basically that, and start it, she absolutely did, because then in 2004, Moyer et al. Did a really good meta-analysis. And when I say really good, I mean from an objective statistical perspective, it was a fantastic meta-analysis. And is actually currently the massage related paper with the highest number of citations, according to Google Scholar, and was interestingly published in Psychological Bulletin. So, again, I referenced in Therapy Live the influence of psychology journals when it comes to the publishing of massage research. Anyway, Moyer's approach was to differentiate clearly between single dose and multi-dose effects of massage. So looking at what studies were looking at the effects after a single massage or after a set of massage treatments, perhaps over, a couple of times a week over several weeks, that kind of approach. And his group also ensured that all the studies, including the meta-analysis, met 3 key criteria. There had to be a comparison to a non-massage control group. The assignment of participants to those groups had to be randomized, and sufficient data had to have been gathered to determine the all-important between group effect sizes, which is one of the criticisms of some of the earlier work, was that it was really looking at the effects within group. And so it was hard to tell whether massage was the difference. So comparing between groups of people who did receive massage and didn't is super important. And in short, the meta-analysis showed that very significant effects, both statistically and clinically, were reported for state, which is the kind of the one-off single dose, and trait, anxiety and depression, and actually comparable to psychotherapy, but no significant effects in other areas such as the reduction of cortisol. So the most recent paper on this that I could find, which was actually accepted earlier this month, and so probably isn't quite in publication yet, continues to support this notion, actually, that massage outperforms regular care in the reduction of self-reported anxiety, but not depression, interestingly, when looking at cohorts of pregnant women. However, given the specificity of this particular meta-analysis, which is perinatal, and the paucity of quality massage research in general, the authors concluded that all the papers involved were at a high risk of bias. However, what is clear is a continued recognition of massage's real and substantial effects on anxiety and depression when compared to control or usual care. The bit that isn't clear is the mechanism behind these effects.
It is really important to understand this depression and anxiety link to massage, as well as understanding depression and anxiety link to people in pain, but also elite athletes. In fact, in a nice and neat meta-analysis in 2019, they showed evidence of symptoms of distress, sleep disturbance, anxiety, and depression of on 34% of nearly 3,000 elite athletes. So 34% displaying mental health symptoms. And if we then make that link to massage seems to be effective for depression and anxiety, then you're already creating, you already have there an intervention that might remove part of what they're coming to you for. But, you know, we have to be very careful that they're coming to us for musculoskeletal injuries.
And I think there it's a good point to make that distinction between what we're saying here is that massage is not a treatment for psychological conditions such as depression and anxiety, and we're not framing it as such. But given that we know there's this link between psychosocial factors and pain, is this beneficial effect on our psychology? Does it go some way to explain the beneficial effects we see from massage on pain? And we know from more and more research that actually there aren't clear, or there isn't good evidence on the physical mechanisms that we've used to explain massage before. And we touched on that in the last podcast, and you know, it's all about the nerves. So we know there isn't that good physical evidence. So is it in fact that we're removing one of these, or we're benefiting one of these other factors? And I think it's also worth saying we're not just talking about people with a formal diagnosis of anxiety and depression. What we're saying is that everybody in their lives has levels of stress, and pain can be a big factor in that, whether it's cause or effect. If somebody's in pain, their likelihood is their sleep's affected, their stress levels are heightened. If we can have a beneficial effect in reducing that, is that where we're getting our benefit from in reducing their pain?
I think, and I think that's such an important point as well. What I found particularly interesting when I was doing my sort of research into this link is that the meta-analyses that exist have tried to look into some of the explanations perhaps as to what's going on, as to why we might see. And what they've done really nicely is they've listed essentially the different potential mechanisms of effective massage. So they've gone back as far as Melzak's pain gate theory, and then they've explored a little bit around are we dialing sort of down the sympathetic nervous reaction and up the parasympathetic nervous system? Is it that we're having a direct sort of biological impact on certain chemicals within the body? And the obvious one to go to is you know, the stress hormone that I think everyone knows, whether they realize what it does or not, which is cortisol. And this idea that, you know, cortisol being strongly linked to the stress response. And what's really interesting actually is there is no clear evidence that massage reduces cortisol. So we get really clear, consistent results that it's affecting anxiety and depression, but actually the mechanism through which it's doing that is really, really unclear. And there actually is a proper back and forth in the literature between, yes, it affects cortisol levels, but we're not going to really tell you by how much and whether it's actually clinically significant. And then the other side, which is, yes, we've seen an effect, but it's basically zero when you look at it statistically. And so given the significant changes that people report in anxiety and depressive symptoms and the totally insignificant changes in cortisol, it doesn't make sense that the small changes in cortisol are what are leading to the large changes in symptoms of anxiety and depression.
Is it contextual then? That's a wonder.
So that does get discussed, yeah.
Yeah, is that contextual? Is it because the room? Is it because the way the Therapeutic Alliance with the therapists, the safe zone, somebody there to listen to you, somebody there to validate your pains? that that it has a lot. So are we removing the threat emotionally more than actually creating something physiological?
And it comes back a bit to what we've discussed before, that we just, as humans, it sort of instinctively know that touch is therapeutic, and it's we'd like to have an explanation for why that is and what's it doing in our brain that makes us feel better, but currently we don't. But we know that we as humans sort of crave that, and not everybody, I know not everybody's that keen on hugs, but most of us, if we feel upset, if we feel threatened, if we feel in pain, we enjoy the comfort of another human being's touch, and that helps to calm us down. And I think that's really interesting. And we've looked before at the sort of history of massage, and the fact that all cultures have some kind of formal touch, if you like, some form of massage, and it's so clear that there's something going on. I'd love to know what it is that's going on, but there's something going on that reassures us, and somehow that down regulates that pain that we're feeling.
And that is touched on, as I say. I mean, I think I've become a bit of a fanboy of the Moyer meta-analysis, the 2004 one, because in there they do try and dive into that a little bit, and because of this. So Moyer is a psychologist by background, so he's not a massage therapist by background, and but it means that he has a real understanding of how research can be conducted in such a way that is meaningful and useful, but perhaps outside of the traditional medical model of here is an absolute placebo, we can run a double-blind trial, etc., etc. All of that is recognized within psychology. And he tries to explore some of this, and because he has drawn parallels to the efficacy of psychotherapy on the reduction of symptoms of anxiety and depression, the way that they actually refer to this is that so for example, for trait anxiety, as part of this meta-analysis, the level of trait anxiety was lower than 77% of the control group participants. So what they're saying is that not that it's been reduced by X amount, but that versus standard care, a greater proportion of the group has benefited. And when you look at the results for anxiety and depression that come out of this particular meta-analysis, I can't remember exactly, but it's sitting like 73 to 74% better off, up to this 77% better off. But when you compare that to psychotherapy, and the sort of the well understood psychotherapy benefits, you're looking at about 79% are better off having taken so it's not too big a leap to say that's comparable, particularly when you look at the length of the sessions involved. So on average within the meta-analysis, the massage, I think it varied from something like 20 to 40 minutes. So, on average, it's a 30-minute session, where psychotherapy generally is your sort of 50-minute hour, it's an hour session. And so there is I think, quite a reasonable question to ask, which is, if context is important, is the amount of time you spend in that context also important? And therefore, if there were studies that allowed a meta-analysis of a 50-minute hour or a 60-minute massage session, could you get even closer to the outcomes of psychotherapy?
And that's interesting, isn't it? Because one of the things that we feel we observe as soft tissue therapists, or a lot of the feedback we get from our clients, is that it's not very often you're given an hour of somebody else's time. If you go to see a GP, you've got a 10-15 minute consultation. Quite often physios working in a healthcare setting have limitations on their time for obvious reasons. So when you're going into a massage setting, it's one of those things that you hear a lot is, I just love having this hour to not think about anybody else, not worry about the kids, not worry about my job, not worry about my training, whatever it is, that they get given that space and that time that isn't present in our day-to-day lives.
And I think that probably beautifully onto sort of the second point that we kind of want people to take away from today, which is that there is a huge value of relaxation when it comes to pain management. Now, what we're not saying, because let's be honest, it's been thrown out a long time ago, is we're not saying bed rest. If you're in pain, bed rest is not the way. It's distinctly different from relaxation and fundamentally feeling good. And I personally think feeling good is underrated as part of someone's journey through their pain experience. I don't know what you think on that, Becky.
Yeah, I think it's a really good point, Matt, that relaxation is good, that something, giving someone an hour of something that feels good and makes them feel a bit better is underrated. I think what's really important is what do we do next with them? So when they've come for that massage, and take the case of somebody with persistent lower back pain, and you've managed to give them that relaxation and that they get off the couch feeling a bit better, tell them to go for a walk. Tell them to take advantage of that feeling a bit better, and that, so we're not saying it's a relax, now go home and sleep for 3 hours. Maybe they need to do that, that's fine, but what do you do next for that client? How are you maximizing that window that you've given them where they feel better? And don't give them explanations that aren't true about why they feel better. It's kind of okay for them to get off the couch and go, that felt nice and it made me feel better, and you say, yeah, that's because massage feels nice.
I agree that no matter what, feel okay, and feel free to feel good and to relax is really important. Again, there's been a systematic review done in 2011 by Miles, and they found that self-efficacy and depression are the strongest prognostic factor, irrespective of the intervention. And they suggest that those two should be targeted at early stages, so that the person, the client, the patient, to prevent them to transition into chronic disability and increase physical disability. So we know that we need to affect that depression and that anxiety as one of our first aims. Why not use, if the particular client in front of us responds better, we be in touch. Not everybody will, but if the client responds better with a comfortable touch, as long as we make them aware that our aim is not just giving the massage for massage sake. Massage is only an intervention to achieve an aim, and the aim should always be self-efficacy, active lifestyle. So as long as the client knows that, and is framed within the right, with the right narrative, that we are not changing any body structure, then I think it's a valuable intervention that can be used with a careful clinical reasoning behind it.
Absolutely. And it's one of the criticisms of, or one of the most used criticisms of massage, isn't it, that it doesn't encourage self-efficacy, that it's a passive treatment that encourages clients to become dependent. And I think that's where we have a massive role to play as modern massage therapists, that actually I really do believe you can use that time and that touch to encourage self-efficacy, because you can use that time to build confidence in the person's body that is so often lost in people that are suffering both with persistent pain and anxiety and depression. They often lose confidence in their body and their ability. So let's use touch to build that and build self-efficacy. And you don't need to be a rehab expert. If you're not in the sort of soft tissue therapy side of massage and you're not a rehab expert, you don't need to be, but you can encourage somebody, like you say, Anna, to go for that walk, to go for a swim, to go and do something active, to pick up their children, those things that they've been nervous of doing.
Can I pick up on when you said about it's the way we frame it, is is the therapist, I totally about being the passive treatment. A passive treatment is made passive by the therapist. Dependency, or even better, dependency is built by the therapist. You can still have a therapist that tries to work with movement-based interventions and still make the movement-based intervention, still make, the client dependent to them, to the therapist. So I totally believe that passive, for me, first of all, is not necessarily, a passive treatment is not necessarily a negative term, as long as the passive treatment it's has the function to achieve self-efficacy. And the other thing also is that for some clients that comes to our doors, there are already those clients that might not have responded as well as with previous interventions. So in our very important subjective, we need to profile the client. We need to look what their expectation, what the experiences are. And that's where critical and clinical thinking is to come into place. If I know that in front of me, I have a client, one of those subgroup of people that there might be more of a danger that they're going to become dependent on a modality, then I will be very, very careful what type of modality, if I use any of those modalities at all, and the way I frame it. So ultimately, we need to be good clinicians.
100% agree. And I think, touching on that modalities you use, I think you can be providing what is regarded as a passive treatment. But to me, there is a big difference between having someone come down and lie prone for an hour and literally lie there while they're being treated, or having someone moving around on the couch, different positions, essentially demonstrating to them that, let's say, for example, they're suffering from shoulder pain, they've got painful arc, and well, why not have them side lying and moving their arm with a shortened lever, with the effect of gravity being quite different on their joint, whilst providing some soft tissue release or some massage around the area. That's no longer passive, yet it's still a massage, it still feels good, but you are encouraging self-efficacy, because you can help demonstrate that after having cleared for red flags and everything, that essentially they have movement in their shoulder that they can provide themselves. You're just demonstrating in this particular hypothetical example, perhaps that loading is the issue, and that perhaps we just need to modify that loading, but to be able to demonstrate to someone that you can move and you should move. Yes, we're in a nice, safe environment. Yes, I've got you in a position you might not have considered lying down in bed and just waving your arm around, lying on your side before, but now I've shown you it, you can go home and do this more regularly.
Yeah, we are exposing them to, if not pain-free movement, we are exposing them to movement that they can do, that this time they can do. And once you expose them to that, they can then build self-efficacy.
Yeah, absolutely.
So I think that's a really good point to come on to our little regular feature of theory to practice. So the idea of this is, how can you take what you've heard in today's podcast and apply it in your clinic tomorrow? So what I want to talk about today, when we think about theory to practice and how you might sort of tweak your practice a little bit, is if we're considering the benefits of massage as a positive impact on our mental well-being as well as the physical aspect, then perhaps we need to focus a little bit less on the specificity of certain modalities for certain symptoms. So I know personally, certainly when I was training and when I was a new therapist, you're very kind of panicky, if you're like me, that you're using exactly the right technique, and have you got your hand at exactly the right angle, and are you exactly on the serratus anterior or not, and have you got into the muscle that you're meant to be working on, and is this the right thing to be doing for somebody with lower back pain? I'm not sure. Actually, we can, when we start to see massage in the bigger picture of treating the person's psychological well-being, and actually using the fact that it's something that feels nice and it's a relaxing treatment for them, we can be a little bit less hung up on the specificity of those certain modalities, but actually think about what we're doing for the client, and are we being specific for our client that's in front of us. So there's no point. I hate anybody doing trigger point therapy on me. I hate it. It hurts. I don't like it. And it really annoys me. There'd be no point using it on me, because that's going to take away all those benefits that we've worked on in the rest of the treatment. However, some people I know really enjoy it, and it does work for them, and it does provide them some relief. So it's getting to know that client and what works for them rather than what works for a tight hamstring. And that comes back to, like Anna's saying about the Therapeutic Alliance, and building that alliance with your clients, taking the time to get to know them, and having that really open communication with them. You know, I always say to my clients, look, I'm going to try a variety of techniques here. Please say if anything feels uncomfortable, or if anything is not pleasant for you, because that's not going to be beneficial in this setting. Please let me know if there's anything you particularly like, or, you know, feels particularly comfortable, or I see some more movement from something that I've done particularly. So it's thinking about those techniques that you use. Are they right for that client, and are they getting the benefit you need, rather than, you know, buying a million books telling you how to do trigger point therapy or soft tissue release, because it's different for every client, because people's feelings about those movements are going to be different. So that would be my take home from a kind of theory to practice thing, is be less hung up on those techniques. Use your instincts a little bit more, and use your communication with your clients a bit more to make sure that what you're doing is right for them, rather than just thinking of them as a set of muscles and a set of techniques that you use to treat them. So that brings us on to our kind of last point that we wanted to make on today's podcast, and we touched on it slightly earlier, that we're not saying that massage is a treatment for depression or anxiety, and we're not just saying that it has a relevance to people with a clinical diagnosis of a psychological illness. But stress, and as we say, we all have stress in our lives, and that can really affect our response to potential threat. And as we know, pain is an output from the brain. It's a response to a potential threat. So if we can use massage to, if you like, manipulate our response to a potential threat and reduce stress, perhaps we're tapping into something there that lowers our response to that pain.
Yeah, really interesting, Becky. In fact, well, it was very interesting what Matt said about, I think it was Tiffany Fields, or the meta-analysis, the Moyer's meta-analysis, where there is positive outcomes, 77% comparison to psychological, to only
to the control group. Yeah,
to the control group, but the cortisol changes were minimal or non-applicable. So what is it that's creating the change? Yeah. Is that the context? Is it the fact that we are removing the perception of threat, so that the brain does not have to answer to it? Could it be that we are creating that, you know, sometimes some therapists call it the sanctuary, you know, the area where they can feel safe, and therefore that stimulates a parasympathetic response. And I think that is tremendously important in any setting, from the athlete setting to the fibromyalgia clients, because as we said before, we know that athletes as well, there is a comorbidity with pain and anxiety and depression.
Yeah. No, absolutely. I mean, I'm gonna quote here from Moyer again. Actually, I'm gonna read it word for word because I think it's great, because it's alluding to, or it's asking the question around what Anna Maria, you love to call the Therapeutic Alliance. This relationship between the therapist and the client, and how important that might be in the context of the client's pain. And Moyes refers to it as interpersonal attention. And so here he writes, it's notable that a series of massage therapy treatments produces reductions of anxiety and depression that are similar in magnitude to those typically observed in psychotherapy research. In addition, massage therapy parallels psychotherapy in structure. Both therapies rely on repeated, private, interpersonal contact between practitioner and recipient, and similar session lengths and patterns are employed. Massage therapy intended to reduce anxiety and depression may be more similar to psychotherapy than has commonly been considered, which could have important ramifications for both education and research. And I think he's onto something there. What he's not saying is what the underlying mechanism is, absolutely. And like we've said, this question over cortisol, I think it's still going on, because yes, there can be changes, but there's been no studies that have actually said, well, is it the massage that's changed it? Or is it purely that you're testing it an hour later at the end of massage? Time is a factor here. I think also as well, if anyone has a particular interest in in understanding stress, and the stress response more generally, and how it can affect us, and how therefore we can draw some parallels to why massage may be helping as part of a stress response and reducing that threat level. Robert Sapolsky, who is a professor in the US, excuse me, and is regarded as the world leader, I suppose, when it comes to stress. He's got a book called Why Zebras Don't Get Ulcers, and it is well worth a read. But you can have a look on YouTube, and he's got some fantastic lectures on there as well, covering this same thing. Excuse me. But is essentially saying that in the animal world, your stress response is only kicking in as a simply for survival. It's a case of, I think he puts it as, by the time it's over, either it's over or you're over. Whereas for us, our stress response kicks in when we think about our 30-year mortgage, and tends to not go away. And so, and we know there are links between that and pain. We know that it can increase the perception of threat, which can lead to persistence in pain or an increase in pain. So why not give yourself time to reduce that stress?
I think as well, what really stands out for me is if we're saying we're using a massage as a treatment to lower the threat associated with pain, that gives us a responsibility as well. Like Anna said, is it contextual, and all those other factors matter in reducing that threat level. But we also need to bear in mind that we are someone that could increase that threat level. So when you do that, oh gosh, you feel tight today, awful statement, actually, are you increasing that person's threat? So I think what's really nice from this research is that we can understand our role as a massage therapist in a wider context. And if that context is reducing threat, we need to make sure we reduce threat in everything. So yes, our touch is positive, but also our language is positive. Our environment is positive. The experience of booking an appointment with us is positive. All those factors around our treatment are part of the beneficial effect that we see. So we need to be conscious of everything.
Becky, I couldn't agree more with you on the language, and that it's one of, for me, it's an intervention per se. And this is something that as massage therapists is people that they're listening to us and they are wondering, what can I change? What course should I be doing? The first thing I will look at, the language you use in your own clinic, the language you use to explain what you're doing, the language you use when you respond to your client. So that is something that we can all and should all start slowly to change, because anything we say, anything we show, anything we do will create expectations in the brain, and will be actually interpreted in the brain in a very different way sometimes that we meant it to be. So we need to be very careful, the client we have in front of us, and how they respond.
And I made myself a rule fairly early on as a therapist, that one of the things that I wanted to be very clear on with myself is that whoever my client is and whatever they've come to me with, and whatever their reason for treatment is, they walk out of my room feeling better about their body than they walked in feeling about it. You know, whether they had lost confidence in it because of pain, or whether they felt a bit chubby because they had a pizza last night, whatever it is, whatever their hang up about their body is, they walk out feeling better about it than they walk in. And so often, Anna, that comes down, like you say, to the language you use. You know, more so, I believe, more so than your touch.
There was some evidence that it was in marketing and advertising. It's quite old. I don't particularly remember the reference, but if you put, I think it was 3 or 4 positive adjectives in front of several other negative adjectives, the person would still come out and would have listened, would have heard the whole statement in a very positive way. So as long as we are realistic and we are not overly enthusiastic in terms of the prognosis, but we can be very positive and very empathetic. Empathetic, can we say that in this country? Yeah. So
Awesome. Well, so I'm hoping people have got something fairly decent out today. I've actually really enjoyed
that. Yeah,
it's really good.
So
enjoyed that. Basically, what we want to send you away with today is the sort of 3 points we've touched on. Is that the evidence is suggesting that one of the things that massage can do is symptom management of anxiety and depression. We're not saying that it is a treatment for anxiety and depression, but we are then making links between the fact that anxiety and depression are common factors in persistent pain. And if we can provide some reduction in that, in those symptoms, then perhaps that is one of the mechanisms that we are using when helping people in persistent pain. And to follow that up, we need to embrace, I suppose, the value of relaxation for pain management. Again, we're not talking bed rest, but we need to feel good, and feeling good is underrated, and particularly where there is a link between someone's mental health and their experience of pain, and that this is not just applicable to clinical mental health diagnoses. We're talking here about the fact that stress can affect your response to potential threat, and that response to potential threat is fundamentally where pain comes from. And so if massage can reduce stress, and we can maybe therefore modify threat, we then might end up with an explanation going some way towards where massage sits. So, Anna Maria, what's coming up next?
So our next podcast will be Intro to Pain Science for Massage Therapists. It's going to be in 2 weeks' time, which is the 3rd week of October. But in the meantime, you can find us on social media, on Facebook at the Massage Collective, or if you have any questions, you can email us at massage@physio-matters.com. Do not forget Therapy Live Sport on November the 7th, which is an event that has a specific focus on the triad of swim, bike, and run, and where the Massage Collective will be hosting a live podcast exploring massage as a tool for recovery post-training and post-event. So don't miss that one, and see you all in a couple of weeks. Bye now.
Ciao.
Bye.